Okay, everybody, we're going to go ahead and get started. I'm sorry. I know there's a few folks who are still trying to get in. Rachel, if you could send me an update on what we have. But anyway, once again, welcome. This is the 19th Annual IHA Health Literacy Conference. And we are doing this a little differently this year, a lot differently this year. This is our first time doing a virtual conference. Our staff has all been working remotely. And we're doing our best to try to work out a few of the technical kinks, and my apologies for that. So, but let's go ahead and get started for those who are able to join us on time. Mario, can we go to the next slide, please? Here's the housekeeping rules or information. Again, I think the main thing is you are going to be muted if you have questions. There's a question box at the bottom that you can type in your question. The important thing is everything is being recorded and will be posted a couple of weeks after the conference. So if you do miss something, you will be able to access that later on. Next slide, please. Also, there's evaluations. If you are asking for any kind of continuing education credit, please be sure you submit that overall conference evaluation at the end of the week. You'll get a link to that. Send that in, and then that is the trigger for the continuing education folks to be able to issue you your continuing education credit. If you're having technical difficulties, there's the email support@limitlessasr.org. All other questions regarding the conference in terms of content, in terms of continuing education, anything along those lines, conference@ihaforhealth.org. Next slide, please. So, why are we here? This is not a typical year. And as you know, it's been a remarkable and extraordinary year. And this conference is really, we originally had, before the pandemic and everything hit, we had a different topic and title for this, but we decided we needed to really focus in on what's going on in the world. And so we reimagined this conference. There were three really major issues that were going on. Global pandemic. This is also including really an erosion of trust in science and public health. There's now been stigma around wearing a mask. The disparities, racial tensions, social injustice, socio-political divisions. Really, there's some historical reckonings that are going on right now. Some behavioral accountabilities, people who are in positions of power or influence or authority are really being called to task on their behavior. Political polarity, like we've really never seen. This whole notion of cancel culture that's going on. So just a lot of issues in that particular area. And then, of course, the economic hardship. People are really having to kind of make decisions between feeding their family and paying the bills or doing what's right to control the pandemic. And these are really extraordinary times. So this conference is really providing us with an opportunity to join together as a community and to really ask ourselves the hard questions, address these uncomfortable issues, and decide what role we as a health literacy community want to take in this really unprecedented time. And so that's really what we're going to be looking at this week. We are going to be taking a very hard look at where our society is and what we as a health literacy community can do. So what is our role? I mean, health literacy in general is about clarity. We can help make information understandable and actionable so that we can help reduce those disparities and provide more equal opportunity for everybody, so that everybody has a chance to have their voice heard and has access to the services that everybody else has access to. We can do that with respect and with dignity. When we hear one another's stories, we really gain a greater understanding of the challenges that other people face and how we can ease suffering and lift other people up. So really this week, and especially our next speaker, Vicki Lorraine, are going to be talking about stories and what are the power of those stories and how do those really unite us and bring us together, okay? Really this week is about thinking and listening and asking questions and cooperating. How can we reduce disparities and start moving toward equity? we have an opportunity to really seize the moment right now. We have an opportunity to really work together as a community and decide what we want our legacy to be. And we can design and create that legacy right now. When this pandemic is over, what do we want to be able to say we as the health literacy community did to make everything a little bit better? And I think our chance to do that kind of starts right now. And that's the way that we really help reframe, rebuild our future, and empower. And we have sessions on this all week long. So this conference is different. We're going to explore, we're going to learn, and we're going to share, but the dialogue doesn't begin and end here. So you might consider this as one point on a continuum of dialogue and inquiry and exploration. And you have a very important role in this. Next slide, Mario, please. Oops, I'm sorry, go back. So there's a few things we are asking you to do. We have a solutions work group. When you go to the conference homepage, there is a tab called Engagement Center. Click on that. And what we're going to do after each plenary session every day, there's a survey that's going to be open for about 2 hours. We want you to answer that survey. We want to hear your key takeaways from each of the plenary sessions. We want to hear about your solutions. We want to hear about the things that you want to continue to explore after this conference. And so we can do that through webinars, through discussion forums on our Solution Center. We have a conference coming up in October, which is a Health Literacy Research, Practice, and Policy Conference. We publish a journal, so you could certainly write articles. And there are going to be opportunities in research, practice, and policy. And also there's a message board. It's called Message Board. It's a networking opportunity also under that Engagement Center tab. So please make sure that you click on that. Okay, thank you, Mario. Next slide, please. So with a couple minutes I have left, I just want to talk a little bit about who we are and what we do. And there's some ways in which you can kind of continue to participate in the health literacy community. So we're a nonprofit organization, a 501c3 public charity. Our mission, empower people to better health. We've been around for a little while, since in health literacy since 1999. I've been with the organization since 2000. We were actually created in 1993. We also run a social services agency called the La Habra Family Resource Center. And we partner with these local initiatives, the La Habra CRCC, which is a local food bank. That was one of the options also for you to make a donation to. And we'll talk about that again in just a moment. We also are part of a local collaborative called the La Habra Collaborative, which has a Move More, Eat Healthy collaborative. And we also originated a licensed community health center, Friends of Family Health Center, which is now an FQHC. And we used to be the administrator for that. Next slide, please. So the IHA, the Health Literacy Solution Center, which is kind of where you guys came into all of this, I encourage you to take a look at that and really browse through that. There's an opportunity for you to do a lot of different things there. We have tools, we have resources, we have programs. You can share your resources. It's kind of a resources clearinghouse, if you will. So you can find resources, you can share resources, there's dialogue there. And just go ahead and explore that a little bit. And there's also on that page, when you go to the conference page, a button if you wish to make a donation to the charities. We're making this a free conference, so we're not charging you anything, but we would really love for you to make a donation to one of these charities. So if you didn't make a donation, I would ask you to consider throwing a few bucks towards some of these charities. If you did make a donation, maybe you could donate a little more. Again, these are charities that are working in the area of COVID-19 relief and in the social justice arena. So please visit that donate page on the Solution Center and consider making another donation. Next slide, please. And one more. That next piece should come up. There we go. So we are doing, as I mentioned, a conference in October. We partner with the Harwitz Center for Health Literacy at the University of Maryland, Cynthia Bauer. IHA and the Harwitz Center have done a conference for a couple of years called the Health Literacy in Action. And this year we are partnering with the HARC Health Literacy Annual Research Conference, Michael Posh-Orlow. And that, so we're kind of integrating all three of these elements, research, practice, and policy. So it's a little different. It's kind of a new thing. We're hoping that it's going to work out quite well, but take a look at that link, and registration we'll be open in a few months on that. That's not until October. So that's coming up, but please mark your calendar for that one. Next slide, please. We are also creating a certificate program called the Health Literacy Specialist Certificates. These are 7 assessment-based certificates in the area of health literacy. It's really a professional development set of courses in 7 different domains. The first one that we are releasing should be out in a couple of months: language, culture, and diversity. These are online, self-paced, very rich multimedia, has a final exam, so it's a very rigorously designed set of certificates, 7 domains, a total of 53 lessons over all of the domains, and more information is available from the homepage. You can click on that. Next slide, please. I think if you click one more time, we've got a bit more copy. There we go. We publish a journal called Health Literacy Research and Practice. Michael Pascharlo and Cynthia Bauer, as I mentioned earlier, are the editor-in-chief and practice editor, respectively. So this has been going on at quite some time. We are indexed, available at no cost. This is an online, open access, peer-reviewed journal, no cost to access those articles, so please check that out. If you're considering writing an article, we would love to see you submit a query on that. Next slide, please. Health Literacy Month. Our good friend Helen Osborne started this a little more than 20 years ago. It's every October, and it's an opportunity for all of us to really talk about health literacy to the rest of the world and share what we're doing with the rest of the world and with one another. So go ahead and click on that link when you have a moment and start planning your efforts for Health Literacy Month now. Next slide, please. Here's our social media Twitter hashtags, so IHAHLC20. Please be kind when you share your comments. I know we're having a few technical difficulties, but let's try to see if we can concentrate on the content and a little less on the technical difficulties, and my sincere apologies for those. Next slide, please. So now I think we're going to go ahead and get the conference, this plenary session started. After the session, remember at the conference homepage, there is the Engagement Center tab. And please click on that and share your comments. So I'd like to introduce, next slide, please, Vicki Lorraine. Vicki is going to talk about stories, really. She's going to talk about how we connect, how we can leverage both our heads and our hearts in reaching out to folks. She's gonna share some stories and really talk about understanding and embracing differences. And that's really where we start. We really ought to seek to understand before we seek to be understood. And so without any further ado, I would like to invite Vicki Lorraine to unmute yourself, come on forward, and let's go ahead and get started. And I'm going to fade into the background. Welcome, Vicki. Thank you so much.
Thank you, Michael. Really appreciate it. Well, we've got about an hour and 15 minutes here together, and which can be a really long time on a Zoom call like this. So we're going to try to keep things fresh and lively and break things up a bit. I'll be speaking for about 15 or 20 minutes. Then you'll be hearing from 4 amazing folks who will share some of their COVID success stories. Then I'll come back to close out the session with some thoughts on plain language and racial equity. So with all of that, let's go ahead and get started. I come from a long line of storytellers. Next slide. Let's try the next slide. And let's try the next slide. Yeah, these are my long line of storytellers. Folks who love the company of one another, whether they're playing cards or shucking peas or making music with their washboards, guitars, harmonicas, and spoons. These are people who are better at cussing you out than complimenting you, but people who love fiercely. So this morning, I'd like to continue that family tradition by sharing some stories as a way to describe my path to plain language and as a way to examine my journey into racial equity. Next slide. To kind of share how over the years the two have bridged and supported one another and brought me to my understanding of plain language's role in helping to cross the racial divide. how in this unprecedented time, plain language must come from our heads, next slide, but more importantly, from our hearts. As I just mentioned, in a little bit, we'll be hearing from some folks who have been doing some great work during this time of COVID. And I'm certain their success stories could be echoed by many of you on the call. And that's what today is all about, as Michael said, learning from one another and getting a sense of all that's been done over the last several months as we've taken on the challenges of this pandemic. I encourage you to share your stories as he did in the solutions work group after the session. You'll find a place to share your ideas and stories by going back to that homepage and again, clicking on the engagement tab. But for now, I'd like to start with a story, one that describes probably my most powerful lesson about relationship with community and sharing power. It was 1989, next slide. I'd just been hired by Eastern Virginia Medical School to expand the school's presence in the city of Portsmouth. Portsmouth is physically separated from Norfolk by the Elizabeth River. And Norfolk is where I had lived, worked, and played for several years. But as I soon discovered, the divide between the two cities was much wider than that river and much deeper than I understood. Next slide. Norfolk was predominantly white. Portsmouth was predominantly Black. Norfolk's population was young, and the gentrification throughout the city was steady. Next slide. Portsmouth population was aged, as well as its buildings and its infrastructure. Next slide. The poverty rate in Portsmouth was really 4 times that of Norfolk. The disparities in health and housing and education always favored Norfolk. Next slide. For many, many years, Portsmouth had carried the stigma of a second-class citizen. Next slide. So fortified with the love of second-class cities, I grew up in Flint, Michigan, and a background in geriatrics and broadcasting, I relished the chance to have an impact on the Portsmouth community. I'd work out of Portsmouth Family Medicine. That was the medical school's family practice residency. So I started with some initial meetings with the staff at the Family Practice Center and some face-to-face visits with a host of community partners. Time and time again, the message I heard was, if you want to have an impact in Portsmouth, you must work through the churches. There was also consensus that I should start with the Emmanuel African American Episcopal Church. It was one of the largest and oldest African American churches in the area. And that I should approach them about being part of a survey focused on hypertension among their parishioners and get their support for holding a health fair at the church. Sounded good to me. Next slide. So in all my sanctimonious, unrecognized white privilege, I marched up the steps of the church and asked to speak with the pastor. By the look on the receptionist's face, I knew I had made a grave error. As she escorted me towards the door, she firmly suggested that I call to make an appointment with the deaconess, who would review my bequest before submitting it to the Health and Education Committee, who would then take it up with the associate pastor before sending it on to the pastor, who would then contact me if he were interested. Next slide. Lesson number 1. There is a protocol for working in and with African American churches, a protocol that requires and deeply values relationship. And for me, relationship is at the core of plain language. It's how we bring heart to our work. So I apologized and retraced my steps. I met with the deaconess, who agreed to set up a meeting with the Health and Education Committee, who didn't like my idea of the idea of a health fair. But they let me know that they might be interested in some training sessions for their parishioners around healthy eating, and that they needed medical help for the homeless population that attended the church's weekly free meals. We ultimately got community professionals to teach about healthy eating, and medical students and family practice residents to provide care twice a month during the meals. It was the first step in recognizing why it was necessary, as Pastor Brooks said, get comfortable riding in the back seat. As I continued working with the churches and senior centers, the nonprofits and schools, I continued to make many blunders, but was given grace by those who I offended. It took getting humble and a willingness to be taught. It required that I learn to listen, truly listen with my heart and not just my head, and let the community guide the direction of the relationship. Along the way, I met many, many folks dedicated to their community and committed to social justice. Next slide. Folks who were doing amazing work and making a difference in quiet, unassuming ways, like Miss Janie V. Wilson, who always arrived for her appointment at the Family Practice Center with a hat and white gloves, and had tutored children in math and science at her home in the housing projects for over 60 years. Or Mr. Carlton Jones, who had single-handedly revived his neighborhood by teaching young men and women construction skills. They built wheelchair ramps and shored up porches. They installed new doors and windows and replaced bricks. They were the folks with the pulse on the community, the experts with much to teach as I continued to learn how much I needed to learn. And what I ultimately learned is that the answers and solutions to the community's needs would not come from me or the medical school, but from the community itself. It took several years, but once a relationship of trust was developed, the community began to share their deepest concerns. Next slide. I discovered that the community viewed the medical school with suspicion. Over the years, they'd often been asked to be participants in the medical school's research projects, but rarely had the medical school shared the results of that research or provided the community with the benefits of that research. And when it was shared, it was never in a form or in a way that was understood or useful to the community. It took years of letting go of having to be right, assuming I had the answers, and learning to step out of the leading role. It also took an attitude adjustment on the part of the medical school. But by the time I left the area 15 years later, the Portsmouth community had taken the lead. The role of the medical school in serving the community had been redefined. Next slide. A new relationship had been forged, one that was built on mutual respect and shared power. Portsmouth also provided me with some of my first lessons in the importance of bringing plain language to all the many ways we communicate. Next slide. It includes the way we talk, the way we write, even our body language. I often share this story of sitting in on a nutrition education class at one of Portsmouth's community centers. A new young nutrition educator was presenting on the healthy eating. It was to the center's 55+ club. She had her detailed handouts and her PowerPoint with colorful slides, complete with graphs and charts and lots of information about micronutrients and amino acids, polyunsaturated fats, and the glycemic index. I was watching from the back of the room, just feet from a cluster of gals who had begun to whisper amongst themselves. One woman turned to her friend and said, "That girl doesn't make any sense. She sure don't speak our language." It was her friend who then raised her hand. The instructor paused. "Yes, do you have a question?" "No," said the woman, "I have a comment. I don't eat nutrients. I eat food. Please talk to me about food." Spoken in true plain language. It's been 20 years since I've left the medical school, but the lessons learned in those years now inform the work I'm doing every day at the Michigan Department of Education. Next slide. My title is education consultant, but the plain language version of what I do every day is I help make sure Michigan school children get fed healthy food at schools. Next slide. I work for an office within the department that oversees federal programs funding school breakfast and lunch. Next slide. In 2019, Over 50% of Michigan's children received free or reduced meals. So when schools were abruptly closed on March 18th, it was all hands on deck to make sure kids got fed. But it also meant new rules, waivers, and guidance from the feds. Lots of information and documents that needed to go out to parents and caregivers, food service directors, and school administrators. Day after day, the information went out. And day after day, the number of questions from schools and parents kept increasing. So one Monday morning, our director put out the word, everything going to the field must be in plain language. There was an urgent need to get the information out fast, but we had no plain language infrastructure in place to make it happen. It was just me and a whole lot of documents piling up. Next slide. Documents that were describing the pandemic EBT program, distribution logistics, the revision of the bad debt policy, increases in the small purchase threshold, updates on reasonable modifications, and dietary accommodations for parents. They included complex requirement changes, major structural shifts in the food delivery, and instituting the nation's first pandemic EBT pilot program statewide. Next slide. Despite President Obama's plain language directive, most of the information coming from the feds, required extensive plain languaging, even to be understood by our staff, let alone acted upon by the schools or in the field and families. After working on a dozen or so documents with staff, it became obvious that most folks just wanted the cliff notes. As one colleague said to me, don't you just have a one-pager that will show us how to do plain language? Next slide. They wanted a formula, something quick and easy. They wanted what I called the plain language pill. But what Portsmouth taught me and my family taught me a long time ago is that there is plain language that comes from our heads and plain language that comes from our hearts. And for me, you've got to have both. If you'll allow me just one of my pivotal moment stories, next slide. I was a junior in high school and I was taking my first psychology class. Every day I came home regaling my mother with all of the wonderful new information I had learned. On the day we started with child development, I spent several minutes informing her about all the things she was doing wrong raising my baby brother. My mother listened to me rattle on about Piaget's theory of cognitive development and the ins and outs of the pre-operational stage and even Bowlby's attachment theory. My mother continued making dinner as she listened. She waited for me to finish my soliloquy, then said, next slide. That sounds real nice, baby. Now can you just say it again from your heart? It's a phrase that has guided my plain language journey ever since. Next slide. So plain language from the head and plain language from the heart. It wasn't until I asked the department staff at MDE to think about the documents with that lens that they began to get it. We talked about thinking with their hearts meant they understood that food service directors in the field were waking up every day at 3 a.m. to prepare the sacks of food going home to families. In rural areas, they were driving buses to remote areas to drop off food. They were managing a whole new crew of volunteers who needed to be trained in food safety. They were reworking cafeterias and establishing pickup sites that had to adhere to strict COVID safety requirements. They were stretched thin and worrying every day that some child was going unfed. Staff needed to keep this food service director front and center as they drafted their documents and emails. The world of these food service directors had been turned upside down over a weekend. It was a new world with new stresses. Our staff would need to regularly ask, what does their world look like today? Next slide. By the way, food service directors have become my new heroes. Since March 17th of this year, food service directors across the state of Michigan have served and prepared, sent home over 50 million meals. What they have done is nothing short of miraculous. And I'm sure there are many in your states who are doing similar incredible jobs. Next slide. So when you actually have a chance to hug again, I hope you'll find a food service director and give them a big squeeze. Anyway, the great news is, after months of feeling like I was pulling plain language teeth at the department, staff are finding that the feedback from parents, food service directors, and school administrators is overwhelmingly positive, and the number of questions from the field has dropped drastically. They're understanding the new information and knowing how to act on it, a core plain language principle. Last week, I got a call from the unit's financial services director, a world foreign to me and where they definitely speak their own language. He had just talked with someone at the USDA about some of their regulatory changes. Between their acronyms and government speak, he struggled to understand what they wanted. But as he told me later, I think I get it. This must be how folks in the field are feeling. So if the financial services folks are calling for plain language help, I feel like we're making great strides. We've got a long way to go before we can say our unit has developed a plain language culture. But COVID has certainly upped our game and hopefully laid the foundation for a promising plain language future. So, not sure how we're doing for time, but I've been at it for a while, and I think it's time to bring up some new voices. I'd like to give the microphone over to several other folks who are out there working hard during this time to make sure this critical information is available for everyone. And although I've only had a brief introduction to their work, I'm excited to hear how these organizations are rising to the challenge in these crazy times of COVID. So I am going to go ahead and mute myself and turn it over. I believe it's Robin and Pamela who will be up first.
Hi there. Hi, everyone. I want to first start by thanking the Institute for Healthcare Advancement in asking Pam and I to join this meeting today. It's really a great honor to be asked to speak here today. My name is Robin Zender, and I am with the UC Irvine Institute for Clinical and Translational Science. And what Pam and I are here to do today is to really talk about kind of the research aspect of, there were kind of 4 subcategories that IHA wanted to focus on, and research was one of them. And so here we are. And so Pam, do you want to make a quick introduction of yourself as well, please?
Thank you, Robin. So I have spent 43 years in the Orange County community as a maternal child nurse. My passion has always been the care of mothers and children who are most vulnerable. And in the last 20 years of that, I was the CEO of a community organization, and I finally retired. So I've been really fortunate to land at UCI. Their emphasis on community participation is very evident when you just look at the fact that you have an academician and a community person both on this call at the same time. And, in the years gone by, research was something a lot of us cringed at because we thought they were going to come in, tell us how wonderful they were from the great sky, use up all of our clients' time and walk out the door and we'd never hear from them again. But that has radically changed especially with the individuals at ICTS who really believe in bedside to bench and bench to bedside. So excited to be here in a room full of people that are involved in the community and hope we give you an idea of how you can interact with an academic institution. So that's what I have to say.
Great, great. So what I wanted to do is just give a brief mention about what the Institute for Clinical and Translational Science is, because I don't think it's generally known. And so the ICTS is an institute that's funded by the National Health Institute. And we're one of about 60 some around the nation. And we exist for the purpose of really kind of expediting and growing and making sure the quality of clinical and translational research it is what it ought to be or what it can be. So we have these little dots around the country of these institutes that really try to raise up the quality and kind of breadth of clinical and translational science. And translational science really is like what Pam just said. It's thought of being bench to bedside, where basically discoveries and developments are translated into something that's very useful, which really kind of fits in with the whole, you know, plain language kind of aspect to what Vicki was just talking about. And so what we've done at UC Irvine to really, what happened when COVID-19 hit was, like a lot of things, research was basically stopped. And it was you could continue research if stopping the research was going to harm the patient, or if you could do it in a way that was no contact. But other than that, we had to stop research. And so we thought, you know, we exist for research. So what are we going to do? And we thought, okay, so what we need to do is to get really cracking on funding projects that can be done during this time and that are important to addressing the COVID pandemic. And so the ICTS has a number of ways that we've done that, but I'm the community engagement person for our ICTS. And so what our community engagement unit did was we have these annual awards. So I think we have one slide. The next slide shows that we have this award. It's been in place since 2009, so for plenty long time. And these are awards to promote community engaged research. And the research, it's really geared toward making partnerships between academic people and community leaders. So it's a lot, this is how we really discovered Pam, is because Pam and her organization of Moms Orange County entered into a research relationship with a UC Irvine faculty person, and they had funding from this CCRI grant program, and they went on to do amazing things. And Pam kind of became the poster child for what can happen when you have success with one of these grants. And they're small grants. They're really for capacity building or for getting some pilot data. But with the COVID-19 thing, we wanted to give a little bit more money. So we wanted to put $20,000 toward projects and, you know, kind of see what we got. And we got more applications than we've ever gotten before. And so I wanted to just kind of outline here a little bit of what projects we did fund. So speaking of plain language, one of the projects was about translating COVID-related materials into 7 Pacific Islander languages. And we have, here in Orange County, we have we have the largest Vietnamese population outside of Vietnam. And so, not that that's Pacific Islander, but we also have a program related to the Vietnamese, but we have a pretty high population of Pacific Islanders that speak a number of different languages. So that's what that project is about. So it's really to try to get the materials into the hands of the people who need it in a way that they can use it. Another project that we have is researching equity in contact tracing. So it's amongst Latino people and the Pacific Islander population and other low socioeconomic status folks in our community. And so it's looking at who's being tested and who's not being tested, and why are there disparities that exist. We have a research team looking at psychological distress among Vietnamese cancer patients in Orange County. Let's see, the impact of COVID on suspected child maltreatment, which is a fascinating subject. The academic lead on that also works quite a bit with domestic violence. So this is all kind of part and parcel of that same thing. We have a team looking at the social and mental health of Latino mothers. Your own IHA leader, Marion Ryan, has connected up with a couple of UCI researchers and also received one of these awards. And they are looking at kind of connection and support needs and meeting those needs for at-risk seniors. And then the last one that were able to fund was looking at ways that people are resilient in Santa Ana, and kind of using the Promotora-led model to go out into the community and to understand what leads to resilience. How are people thriving, so that it's not just from a lack standpoint, it's like from a resources standpoint. And so that's one of the ways that we've responded to this crisis that's been happening. And it's really, people have really come together. They always say that crises bring the best out in people, which is too bad that we need a crisis to do that. But Pam, is there anything that you wanted to add?
Yeah, I think what I'd like to say a little bit more about these grants is that when we first broached to the powers that be that we wanted to reach out to community agencies during this time of COVID and say, hey, would you like to do research? We were sort of laughed out of the room, because the thought was that all nonprofits were in crisis mode. They had no bandwidth to do anything else. But both Robin and I felt that we at least should give them a chance. So we made some phone calls and did some fact gathering. And, I think for any nonprofit to do research is really a step outside of their norm, and it's a dedication of resources. So we were surprised that we had so many say yes, because whether I'm doing this as a program evaluation or potential pilot program or way to expand the capacity of my program, it's what we need, because COVID's not going away tomorrow. And so it was really exciting. And I guess I'd like to make a little plug for research in general for nonprofits, is to approach your local university to see if they do community participatory research. And I know that Robin or I would be happy to send you kind of the guidelines we use, but probably I like, showing where the money goes, and let's face it, sometimes money shows us parity or disparity. And in these grants, more than 51% of the funding has to go to the community and less to the academician. So that really, to me, is visually representative of how this works. So I would just encourage you to reach out and find out where the Institutes for Clinical Translational Sciences are in your area, or if you're here in Orange County, reach out to UCI. It's a little bit of matchmaking. We find an academician that is interested in what you're doing and not the other way around. And so it's been really exciting to see how our community agency of nonprofits has really jumped up to be involved in this. And as Robin said, it's about developing a relationship. And so just because you have one small grant doesn't mean that you can't apply again. So I'm really looking forward to seeing how all of the COVID grants that we funded grow, develop, and where they go from here. So that's about it. Can you think of anything else, Robin?
You know, just one other little thing that occurred to me while you were talking, Pam, is that out of that a relationship grew out of this actual project as well, because some of these, well, a number of these projects were funded through a brand new relationship that we have with the Orange County Healthcare Agency. And so they are putting some of their, what is it called, CARES Act funds toward these research projects. And so this has really opened up a lot of opportunities just for the ICTS and for community engagement for us as well. So that, you know, so it's exciting on both sides.
Yep, it is.
Yeah.
Thank you so much for the opportunity to speak with you today.
Likewise.
Okay, so I think next in our queue of organizations is Susie Newby. Susie, if you could step on up and introduce your great work.
Hi, you guys. My name is Susie Newby. I am a clinical director and a speech language pathologist that works for Genesis Rehab Services. So Genesis Rehab Services is a company that provides therapy services. That's physical therapy, occupational therapy, speech therapy, and respiratory therapy, which all of these are very important during the time of COVID-19. We service skilled nursing facilities, long-term care facilities, independent living, and assisted living communities. So you've probably heard with the coronavirus how it has really affected those the geriatric community living in skilled nursing, long-term care facilities, and how vulnerable that population has been, not just because of their medical comorbidities, their complex medical history, but due to social isolation, because we've all been dealing with being in this kind of quarantine bubble during the coronavirus, being kind of hunkered down with our families, with our immediate people that we live with. But when we think about our elders that are living in long-term care facilities that have other comorbidities that they need skilled medical attention for, these people are living in a facility where they are not able to see their family in person. They are not able to have visitors. And actually, all of our facilities, due to infection control procedures, our residents have had to isolate in their rooms. So you can see this slide. Thank you for being intuitive and bringing that up. We really wanted to focus on, even though we may be physically separated, we really wanted to remain socially connected. So isolation, loneliness has been a growing health epidemic in our geriatric population for decades. And with a pandemic like COVID-19 and the mandatory physical distancing, this has just exacerbated that. So when we think about the adverse effects of social isolation and loneliness, it really can increase our older adults' mortality, that have early morbidity. It affects their cognition. When someone is socially isolated and or experiencing loneliness, they are more predisposed to depression. And we know that depression, with all the research, all the great things that Robin and Pam are doing, that research shows that depression actually it can directly affect one's cognition, all those executive functioning, those problem solving, attention, all of those complex cognitive skills. They also have an increased risk for hospital readmission, increased risk for falls, either a physical, a fall like a physically mechanical fall, or due to that decreased cognition, and maybe they weren't doing that sequencing or problem solving. They're going to have less activity. Our residents have been in their rooms, sometimes because they can't go out in the hallways, they can't go to communal dining, they can't go to activities. All of those have ceased in the time of the coronavirus. So they're in their rooms, not getting their same physical activity. So they're going to have less activity, less oxygen to the brain. And that also can weaken their immune system. And there's just so many different negative side effects that can happen. There's actually a medical diagnosis called failure to thrive. This is an ICD-10 medical diagnosis, which we're unfortunately seeing more and more of due to this social isolation, which can result in weight loss. People have decreased appetites due to this depression. So we really made a big concerted effort in our institution, Genesis Rehab Services, to really make sure that even though our residents were having to stay in their rooms, that we were really feeling socially connected. We were trying to be creative and flexible and engaging our residents. So one of the things that we did, and this is on the next slide, is that we created a virtual wellness program. So we can't go in and have the regular activities classes we would have. So we have created a virtual wellness program like we're doing right now, where we have a clinical director, a therapist, provide an exercise program. You can see it goes all the way from mind to body to soul, with meditation and mindfulness, a weekly affirmation, a positive affirmation. We need to feed those emotions and that soul as well as the physical body. Functional strengthening, flexibility, cognition, maximizing your memory, progressive muscle relaxation, chair yoga, seated tai chi, and then a moving groove, bringing back some good tunes to help inspire some of our older generation. So this is just one of the many things that we have instilled during this crazy, unprecedented time. We've also been flexible. Our therapists, physical, speech, and occupational therapy, have been flexible going in the room for treatments, doing very functional treatments. We've been collaborating with our activities departments in our buildings. I've seen pictures of people doing karaoke in the hallways because we have to be social distancing. So we have a portable microphone that's going from room to room, of course, being sanitized in between each resident, but there have been such amazing work being done by our essential workers. And I just wanted to finish by giving a huge shout out to not just the nurses and the doctors that come to our head first when we think about those essential workers, but the therapists that are there providing care, especially those respiratory therapists. We know COVID is such a pulmonary disease. And also the speech, occupational, and physical therapy, keeping our residents, our patients physically strong, mentally strong, and the CNAs, the housekeeping, maintenance, dietary. These are our essential workers that are there every day, making sure that our residents not only are healthy and are staying strong, but they are feeling socially connected. We have become the family of these residents, of these patients who cannot see their family. They cannot see their friends. They can see them through FaceTime, but it's not the same. And a lot of our residents with dementia, with cognitive impairment, they take their cues from the environment, from their caregivers. And with COVID and the layers upon layers of PPE that we have, it's been really difficult for a lot of our residents to orient, to remember that the coronavirus is happening. And that's why things are different. So I just want to give a great shout out to all those essential workers out there. I know how hard it is to wear those layers upon layers of PPE, and we just appreciate everything you're doing. I just wanted to share with you our experience with a little bit different population that some other people on the panel are talking about, but our older adults that are really just in such a vulnerable position right now. So if you have any older adults in your life, please reach out, give them a FaceTime, give them a shout, because we really need to stay socially connected in this time. So thank you so much for your time today. I'm passing it back to Vicki.
All righty, thank you, Susie. Really appreciate it. And I think last but not least, we'll be hearing from Terry Green.
Thank you, Vicki, and I'm so appreciative to join this dynamic discussion and address the strategies that are so vital to our communities. What I am going to be talking about and sharing is our experience with working on a multilingual community town hall that was conducted in the town of Randolph, Massachusetts. And Randolph is one of the higher risk communities for COVID-19, partially because of needs, older adults, many senior residential facilities, and also assets, including a very rich immigrant community with many different populations, and also essential workers who are out there providing the services that we all rely on, and as a satellite of Boston.
Terry, I'm sorry to interrupt you. This is Michael. We're having some kind of major issues with your audio. I wonder if we might switch over. If it's a quick fix, go ahead. Let's try that. You sound like you're talking from the bottom of a mud puddle.
Yeah. If this works.
Go ahead and say something. No, actually, it's still bad. Why don't we do this, Terry? Why don't you mute yourself for just a moment, and then Vicki, I don't know if you want to do a couple of slides. Terry, if there's anything else. No, it's still very murky and robot-like.
All right. Take it away.
Yeah, so go ahead, and I'm sorry, just mute yourself a bit, and let's just go ahead and skip over to Vicki, and then Adrienne, maybe you can, on the chat box, work with Terry to see if we can get this squared away. Sorry, everybody. So Vicki, why don't you go ahead, and Mario, why don't you advance to the next slide while we work.
Okay, I was just wondering if we needed to put Rachel in the queue, because this is actually Mario Terry's, I know, one of Terry's slides.
Yes, let's do that. Rachel, are you okay to go ahead and jump in?
I'm here.
There you are. And
all righty, it's all yours, Rachel.
All right. Thanks, everyone. My name is Rachel Roberts, and I'm the Manager of Community Health Engagement and Strategy at the Institute for Healthcare Advancement. Our office is located in La Habra, California, and we are very much a part of our community. We're working from home now, but we're very much a part of our community and a member of the La Habra Collaborative, which is perhaps the most dynamic, diverse group I've ever been a part of in my entire public health career. Normally, when you're part of a collaborative, it's public health people or health folks, but this group is comprised of our faith-based community, our nonprofit, our for-profit agencies, education, K through 12, and also college. We have representatives from our law enforcement, the city officials. So with this group, they're dedicated to improving the health of their community. And so when we want to get things done, we have everything in place and the minds in place and the ability to make those changes. Our role as IHA is to work with seniors. And so I lead a group who are dedicated to older adult health in La Habra and in North Orange County, primarily La Habra. And we've always done things in person, marketing in person to just establish the trust with our community and hosted events for them in person. And when the stay-at-home order was issued in March, we had that panicked feeling that I'm sure a lot of you felt of, oh my gosh, how do we reach our older adults? How do we communicate with them? How do we give them the information they need? Because as we know, most of us were confused, and we knew the consumers were confused as well. Well, fortunately, through our strong collaborative and relationships, we worked with the city of La Habra and another group called Hillcrest, who had the names and phone numbers of all of our older adults who were part of our nutrition programs, and there were about 4. And they arranged with them to deliver food and meals and household supplies like toilet paper, which we couldn't get in March, paper towels, and things they needed. So IHA decided, well, as a good way to communicate with our older adult residents, we would include print materials in the delivery boxes of the food and household supplies. So we created a very simple, plain language handout about what is coronavirus, COVID-19. What does a stay-at-home order mean? Who's more at risk? What can you do? And where can you find more information? So as we were creating the flyer, we also, the La Habra Collaborative, decided to transform their website into a COVID-19 specific website to provide plain language information to the residents. So we started including, we emailed the handout to the organizations delivering food, and they printed it out and put it in the boxes. And then we transformed the website and included information for seniors about where to go for food and supplies, where to go if they wanted to, and for all the residents, where to go to attend church, virtual church, where to go for additional help, for resources, for emotional health. And to promote that, we again used our partners to send them a flyer to include the lahabracollaborative.org website and include that in their materials that they're sending to our seniors. And we communicated that way because we wanted a place where our residents, and especially our older adults and those more at risk, we wanted a place that they could go, a one-stop location where they could get valid and reliable information, because we know as professionals where to go. We know the CDC sites, the California Department of Public Health sites, your local healthcare agencies, but we knew our consumers didn't. So we designed the website using plain language principles, not only with the words we used, but also with our design. And we marketed that again to the community. Moving forward, we are looking at ways to reduce social isolation, like Susie just mentioned. We're working with our local La Habra Community Center. I'm talking to other community centers who are planning things like a Zoom bingo or a telephonic bingo. So we're doing a lot of things in our community to help address social isolation and help raise awareness and help educate our consumers using simple language and principles that we know will help them understand. So I'm going to stop just in case we have Terry's audio up. Do we have Terry again?
I am here, but I'm not sure if my audio's any better.
It sounds better. I'm not sure if we have time. I didn't want to take up all of her time as well, so I'm going to stop there. Just
no, Terry, you sound and we can see everything wonderful. So let's go ahead and turn it back over to Terry. Thank you, Rachel. Appreciate you jumping in.
We'll try again. So I'll be brief. Thank you, Rachel. And I just want to share our example. I come at this, and you can go to the next slide, but from environmental health, a little different way than perhaps health literacy from education standpoint or healthcare, where we studied about risk communication. But as in Vicky's journey, we also learned that it's not just about how to get people access to information or even in ways that they can understand or use, as important as that is, but to recognize that expertise about the risks of harms of whether they're man-made or chemical or biological risks in the environment, that the public, residents, workers who are affected by these problems have as much expertise and assets to bring as do experts who come from outside to try and share this information. So we were asked by the town of Randolph, Massachusetts, in helping them convey information about the newly emerging at the time coronavirus disease back in March. We were going to hold it in a senior center. We obviously didn't want to bring people there. As we learned more about the virus, it was going to be a town hall. and then eventually was virtual. Now this meeting hosted by the city councilors and the health director was wonderful in that, as you can see from some of those here who are participating, we did focus on being low literacy and very visual, using plain language, but we also wanted to learn about the community ahead of time and some of their needs, and make sure that it was in the different languages that and cultures spoken, rather than just translate what my colleague Tabitha Jiri, she's in the center of this, herself an immigrant from Zimbabwe, but our expertise as emergency planning, environmental health, epidemiologists, we actually also had those in the community as co-participants who shared their expertise and knowledge of their respective communities. So you see in the bottom right, Dr. Bercy, who's a member of the Haitian Creole community in Randolph, Dr. Nguyen to the bottom left, who is Vietnamese background. At the top right, Frank Poon, who's an Asian health outreach specialist for the South Shore Elder Services. And then at the top, the health director, Jerry Covid, and the two on the top left, Katrina Huff, who is a city councilor, Larmond, and Ken Clifton below her. So next slide. They all engaged in the discussion, sharing what they knew in terms of expertise about coronavirus, as well as at the same time translating one another, and we all learned together. We did include some special information. We stuck to try to share what the CDC messages were, so as to keep messaging consistent, not to confuse people. But at the same time, we learned a little bit more about the needs in the community and some special topics, including how to transport safely for those who needed to use public transportation, how to do that as safely as possible, how to take care of loved ones at home. There's a lot of people who are workers in where they need to clean and disinfect, but also for people's homes, a lot of concern, of course, about cleaning safely. But we were also concerned in doing that for people to understand the difference between cleaning, that is most often what's needed and helpful, and when and how one needed to disinfect, and how you could do that more safely, including making sure you're diluting and not mixing any chemicals like bleach and ammonia that can be deadly. Next slide. We also focused a lot on stigma and prejudice, and making sure, if you recall the time, and obviously, unfortunately, some of it's still there, but early on, there was a lot of stigma against the Asian communities in particular, with blaming Asian countries for having, well, China in particular, but it spread across all Asian populations, of bringing coronavirus to us, and misinformation, fear, and a lot of anger, unfortunately, as well. So we dealt with that directly in our presentation. We tried to showcase in our collaboration and mutual respect how we can benefit from one another, and do benefit from pulling together as a community. I have up here some resources that are available to you that Massachusetts has made, and there are others about green cleaning. But I just want to close with what Town Councilor Clifton wrote to us about how much of a success they felt this was, and that they were hoping this is but a start to great things ahead for our community, particularly members who are at times left out for one reason or for another. We've made us all trailblazers. So with that, I'll close, bring it back to Vicki, and let you hopefully keep on time.
All righty. Thank you so much, Terry. And thank you to Rachel, Susie, Robin, and Pamela. I don't know about other folks, but I feel like I've met some kindred spirits. And I think that's going to be really important in our work as we go ahead. Mario, can you hit that next slide? There we go. So I'm from Flint, Michigan, and fiercely proud of that city that defines me in so many ways. It's a city loaded with Southern transplants who came looking for work in the automobile factories, bringing with them their prejudices and their Baptist beliefs. Fiercely independent folks while living in the womb of General Motors, in 20 by 20 houses, next slide, that they threw together on streets named after men who pioneered this one-horse city. Next slide. Where eventually every driveway had 3 or 4 GM cars. My father was an only child of parents who could really afford to give him the best. He came from several generations of Michiganders. Next slide. My grandfather and great-grandfather carried names like Williams and Belding and Henderson, men and women who arrived by boat from Northern Europe and carved out substantial farms in their frigid new homeland. They were no-nonsense people who were shy on words and valued no-frills language. My mother, on the other hand, came from a long line of sharecroppers. Next slide. She moved from Pocahontas, Tennessee to Flint with her parents and 6 brothers to find a better life. They're passionate people who have lived most of their lives just making it. Left behind their Southern roots, their sharecropping heritage, and their cousins with names like Talmadge, Lou Rainey, Roe Mildred, and Verevery. Next slide. They brought nothing but the strengths of their spirits and their strong opinions, which they expressed without regard. A red flag of the white privilege they failed to see. But it was on the laps of these folks that I sat for hours on end, listening. Their voices weaving the threads of stories and a language that molded me. Next slide. But it wasn't until I fell in love and moved aboard a sailboat and cruised around the world for 10 years that I realized I had become bilingual. Not that I learned a new language. No, what I learned was that the voice of my youth was very different from the voice I now used. Next slide. A bachelor's degree, followed by a master's degree and years of world travel had given me access to worlds and words my family didn't understand, and more importantly, didn't appreciate. Words like implement, utilize, engage, and impactful didn't fly around at those family gatherings in Flint. Using them would have been a sure way to get me a gentle knock upside the head or a reminder that nobody likes a Miss Fancy Pants big shot. I remember the first time I said to my Uncle Travis, I'll just go ahead and reach out to Cousin Sonia. Reach out, he asked. What do you mean? I mean, I'll give her a call. Well, why in the hell didn't you say that? He said. Next slide. So I learned when to get rid of the reaching outs and drilling downs and leveraging strategies, and when to dazzle with my verbal acumen. I grew to appreciate the rich conversations both languages offered. But I never forgot, and I continue to appreciate, that folks back home care less about my fancy new high heel shoes and more about where those feet of mine have been since the last time we sat side by side. That data means little and loyalty means everything. That a picture tells 1,000 words and people quit listening when I use the word utilize. If I can digress for just a minute and talk about the word utilize, that word has always rubbed me the wrong way. I suspect it's that part of my brain molded by my family, but whatever the reason, I was overjoyed when I discovered a linguistics professor from the University of Michigan say on NPR, the word utilize is one of the most incorrectly used words around, that we should rarely be using the word utilize. Next slide. In fact, utilize should only be used when you're using an object in a new or non-traditional way. Like it says here, I use my pen for writing. I utilize my pen as a bookmark. Anyway, I felt vindicated in my aversion to the term, and I leave it here for you to decide if and when you want to use utilize. So anyway, how do these stories of my youth, stories of my family tie into racial equity? For the past 30 years, I've been actively involved in racial equity work. But it has been a slow dawning to realize a lot of racial equity training is not plain language. Next slide. That most racial equity workshops I've attended speak to folks who understand words like having a dialogue, being transparent, creating synergy, recognizing disenfranchisement, bringing authenticity, and triggering people. Next slide. I've watched many folks disconnect in workshops where words like cultural appropriation, implicit bias, diaspora, ethnicity, inclusion, intersectionality were tossed around with little explanation. Where cultural competence, reparations, and gentrification were defined, but never discussed in a way that engaged the heart. This definition from a training manual on a racial equity workshop I attended several years ago is one I still don't understand. Next slide. Cultural humility is the ability to maintain an interpersonal stance that is other-oriented in relation to aspects of cultural identity that are most important to the person. If these terms are meant to help us, all of us, bridge the racial divide, I would suggest there is a need for plain language. Next slide. Instead of having a dialogue, we might be better off just to talk. Instead of being transparent or authentic, how about talking about honesty and truth? And instead of disenfranchisement, maybe it's about recognizing when somebody feels left out. Now, having said all that, I realize many of the terms used in racial equity training today come from communities of color and need to be respected and honored. That we live in a world where big words and complexity are often given more value. My push here for more plain language or a more plain language approach to racial equity work is not about what are the right words, because there is no right or wrong, but about applying the same sensitivity we do in plain languaging our documents to the words we use to create conversations around equity. COVID has opened a festering wound. We can't escape the racial disparities in deaths. Next slide. Blacks are nearly 5 times as high in terms of their mortality rates. Indigenous people, not far behind. Pacific Islanders, Latinos, and Asians double or nearly double. The numbers don't lie. Next slide. The murders of George Floyd and Breonna Taylor and Ahmaud Arbery only made the room more gaping. Next slide. I marched in the 60s and 70s for civil rights, for LGBTQ rights, for women's rights, but something feels different this time. The unrest in the streets is reminding those of us who are white, it is time to do our work. Next slide. And we can use our plain language skills as we do it. I'll start with the word looting. Let me first say, I don't condone looting, and I'm in no way advocating for it. But what I'm promoting is the idea that our focus on and our rage about looting is a red herring. It takes the focus off the restraint of hundreds of peaceful protests worldwide. It takes the focus off the more serious and legitimate issues of people caught in systemic racism. My plea is to focus on where the fury of looting is arising from. Looting allows us to focus on the harm to property rather than the harm endured by people. Looting allows us to stay in a place where we don't have to get to the root of the problem. So the word looting, its connotations are dark and ugly. But how would our thoughts change, our hearts open, our call to action become clearer if we spoke of looting as, the next slide. Next slide. Group rage at injustice. I ask you to sit with that for just a moment. Although it doesn't lend itself to a protest chant, next slide. This quote from Reverend Dr. Martin Luther King is an explanation of looting that speaks directly to my heart. Looting is the language of the unheard, It is people trying to get the attention of the oppressor when other means have failed. And then there's the new phrase, defunding the police. Although I've read a lot on the topic and I understand the reasoning behind defunding the police, the concept is complex. And having chanted rallying cries at many a protest, I wonder if this chant might better keep our hearts open, yet stay true to the fundamental tenets of defunding the police. Next slide. Reduce police funding, invest in our communities. Reduce police funding, invest in our communities. Or starting a conversation with a phrase like, let's reduce police funding and use those funds to support important and neglected areas like education, public health, housing, and youth services. Since the murder of George Floyd, I've had many white friends and colleagues ask, what can I do? Where do I start? Next slide. My first question to them is, are you a watcher, a reader, or a listener? Do you have 10 minutes, an hour, or a day? But before you start reading or watching or listening, you need to ask yourself, why are you wanting to learn? Ask yourself with each reading, each watching, each listening, what action does this information compel me to take? Because although reading, watching, and listening are important, our time now is calling for action, not just for a month or 2 or 3, but for a lifetime. So if reading is your go-to, there are literally hundreds of books that can help you wherever you are in your anti-racist journey. Next slide. The books I mentioned here are some of my favorites because they all speak in plain language and they share through story the issues of white supremacy, systemic racism, microaggressions, and police brutality. So first, there's the powerful voice of Ibram Kendi in his book, How to Be an Anti-Racist. And one of my favorites is Tears We Cannot Stop, a sermon to white America by the Reverend Michael Eric Dyson. And the one I just finished not long ago, So You Want to Talk About Race, by Ijeoma Oluo. Next slide. If watching is more your style, here are some documentaries. And in the same storytelling vein, they shed a powerful light on systemic racism. We often fail to see it. I'm Not Your Negro is narrated by actor Samuel L. Jackson, and the film explores the history of racism in the United States through author James Baldwin's memories of civil rights leaders like Malcolm X and Martin Luther King, as well as Baldwin's personal reflections on American history. The 13th explores the economic history of slavery, post-Civil War racist legislation, and the practices that replaced it. And if, next slide, please. And if listening to podcasts is more your choice, Uncomfortable Conversations with a Black Man is a good place to start. Spoken in heartfelt, plain language, it will definitely open your eyes. I know it did mine. It's actually the first in a series of episodes, so you'll find more on YouTube. All you need is Google and an open heart. These personal favorites are just a few of the many, many resources out there. I encourage folks to, on the call, to share your favorites, those that have spoken to your heart. Throughout the course of the week, regularly visit that engagement tab that Michael talked about back on the homepage. Let it be a space and a place where we can share our best, where we can grow in relationship. Let me wrap up by saying, at the core of plain language is relationship. So we have experience doing this. Next slide. As we're reading and watching and listening, we must continue to ask ourselves, how will this resource help me take action to develop relationships with Black and brown people, with people different from me? As we do this work, we must stay curious, to have shoshin, or what the Zen Buddhists call the beginner's mind, to find humility, to accept we have much to learn and open our hearts wide, and to always remember how important it is to be open to those that are generous enough to tell us when we've screwed up. It is our choice to determine how hard we will work, how deep we will go to do our part in eliminating systemic racism in the US. Most of us on this call have been working hard to do just that with our literacy and plain language work. Many of us may be far down the racial equity path already, but for all of us on the call, it's something we can do because this is who we are. Because plain language is our work, racial equity is also our calling. So I encourage you to go beyond your comfort zone. Be willing to set in discomfort and share your stories. For in the words of Dr. Gail Christopher, it is through our stories that we discover our humanity. It is through our stories that we share our hearts. Thank you much. Michael, I'll turn things back over to you.
Thank you, Vicki. I really appreciate that. And I want to also say thank you to the rest of the panel. If you can go ahead and unmute yourself, everyone. Terry, Rachel, Susie, Robin, and Pam, thank you so much for sharing all of that. And as Vicki said, for sharing your stories and information about your programs. I want to just make a short announcement to everybody that as most of you know, there have been some very significant issues with the platform today. The platform, Elevate, actually crashed this morning. And so my apologies for all the issues that you had in logging on. We are working on that. This is a separate company that we're working with. I'm not trying to point fingers or what have you, but just so you know, this was a technical issue, and that our full attention is being directed toward that. I know there are still many people who are trying to log on now as we speak. We have about 250 people on the session, but we will try to get this resolved by the end of the day. And we hope that the rest of the week goes much more smoothly, technologically speaking, than it did today. And again, just please accept my sincere apologies for any trouble that you had logging on. So now I would like to go ahead and get to some of the questions. Somebody asked if we were going to have access to the slides. Mario, I believe that those are on the center. If you look under content, can you unmute and just confirm that for me? Sorry, so Mario is our technical person. I think he's probably otherwise engaged at the moment, but the answer is yes, you will have access to the slides, and those will be available to you. Robin, somebody was asking a little bit earlier if you could repeat the name of your local institute.
Yes, so we're at the University of California, Irvine, and it's the Institute for Clinical and Translational Science.
And just one more time, please.
The Institute for Clinical and Translational Science.
Great, excellent. Thank you very much. Also, just so that everybody knows, we will, all of these sessions are being recorded. So whatever you happen to miss today, all 5 days in all their entirety will be made available on the site. We need to do a little work on them after this week, but probably by that first week in August, you will be able to access all of those slides. So let's see. A lot of these questions are more about logging in, and I'm sorry. Vicki, could you share the quote about Stories and Heart, what you shared at the very end? Somebody said they loved it, so Jennifer Russell said she loved it. Could you share the quote again about Stories and Heart?
Sure will, hang on here. It's from Dr. Gail Christopher, and it says, "It is through our stories that we discover our shared humanity. It is through our stories that we share our hearts."
Great. Thank you so much. Mario, are you able to hear me, and can you respond to a question?
Yes, I can hear you.
Thank you. Somebody wanted to know if the link that they used to get in can be used for all the subsequent sessions today. I'm assuming those will be.
No. Each session has its own specific Zoom meeting.
All right, so how would people for the session coming up at the top of the hour, how will they be able to attend that session? Will they need a new link, or how will they be able to attend that?
I'm looking at the platform right now, and they're saying that it's up and running. So they'd have to go back to the Elevate platform and obtain the link through there.
Yeah, I could answer that as well. Basically, attendees, once this session is over, go back to the agenda accordion, look at the next session site, and it will tell you either to open up the session once it starts at top of the hour. And that would be the same for each session you would attend. You would have to enter in through a new entry point.
Okay, so Adrienne, I'm sorry, can you just repeat that one more time, just so people are very clear on that?
Absolutely. So for all attendees that want to enter into the next session that's happening at 1 p.m. Eastern time, you would go to your agenda for Monday, look at the 1 p.m. Time slot, and then it would give you an option to enter into the session itself. Each session is hyperlinked to a Zoom webinar. It's just a front-facing, which will then bring you into it. There should be no more site issues or any technology issues. That's been resolved on the back end.
Thank you very much. The next question, somebody asked about the quote about seeking to understand before you seek to be understood. Where did that quote come from? I know that's one of Stephen Covey's 7 Habits of Effective People. There's also a little bit of attribution to St. Francis of Assisi, where he says, may I seek to understand more than to be understood. However, that link is, the attribution can only be traced back to about 1912 or so, as I understand. So probably the most direct attribution for that quote is from Stephen Covey, and I would not be surprised if he actually got it from that prayer of St. Francis of Assisi. Rosa Arvizu was asking, Vicki, could you elaborate a little more on the Uncomfortable Conversations with a Black Man series and a brief intro?
Yeah, it's the fellow's name has just left me. I apologize. It's actually on the slide.
Can you go back a couple slides, Mario? There was
yeah.
just 1 or 2 slides back.
Yeah.
There it is.
Nope. One more forward.
There we are.
Nope.
You almost had it.
One back, 2 back, 1 more back. Right there. Yeah.
Emmanuel Acho.
Yeah, Acho. Actually, a former NFL football player. Anyway, he started with, and I've seen 2 of the series. He started with this uncomfortable. The name of the series is Uncomfortable Conversations with a Black Man, and he has, I believe, at this point, I've been able to access or know about 4 different in the series. He basically sits on a stool with a very white background and provides perspective around issues of race in America and how we have conversations about that. I just really love his style and kind of how he approaches it. And I'm sorry, the link didn't show up in here, or I just didn't get it in there. This is the first one in the series that I was referring to. So anyway, I don't know if that answers the question, but it's a wonderful, wonderful series.
Yes, I think so. And I think essentially, if anybody has trouble finding it, I think if you just Google that, either Emmanuel
you can,
or the title, it'll take you to a link.
Yep.
Thank you. Great. And also Lynn Nguyen wanted to just recognize Vicki for your powerful presentation. I would certainly echo those comments, Vicki. Wonderful, wonderful job. Thank you. As did everybody else, but just wanted to, that shout out was given you.
Thank you. Thank you.
I just wanted to pass that along. Somebody was asking about obtaining CHES credits for the sessions. Yes, for any continuing education, you need to, at the end of the week, you will be sent a link to an overall conference evaluation. Once you complete that overall conference evaluation, you will get a link for your continuing education. If you did not provide your type of credit or license number that you wanted to, please go back into your original registration and add that information, and you will be able to get that continuing education. Let's see, other questions that we have here. Adrienne, if you could come back on. people were just asking if that direct Zoom link could be posted. If you feel that that is not necessary, that's fine, but just wanted to make sure that that question got asked, as a few people did ask that question. Adrienne, are you still there? I think maybe she's muted, or perhaps she left. Okay. We were told that if you just go to the accordion for the agenda and click on the session, which will open up at the top of the hour. It doesn't open up early, but it opens right at the top of the hour, that you should be able to access that, that session. Vicki, somebody wanted to know what kind of webcam you're using. They said it was very clear.
You need to thank my nephew, who is a total techno geek. And when I told him I was doing this virtual thing, he said, Vic, I can get you a camera, you know, that'll like really make you look good and everything. So I could give you his website, I guess, but it's actually a separate camera and you know, some lighting and stuff. So yeah.
Okay.
Yeah.
And then somebody also, and this actually may work in that person's favor. Somebody wanted to know your email address. So could we go back a slide, I think, or where's Vicky's email address? Yeah, there we go.
Yeah, there it is.
Okay. Okay, let's see. I'm just kind of scrolling through the questions. If anybody else had any other questions, please go ahead and post those. We've got about 4 more minutes. Let's see, the slides. Mario, somebody was asking if they can download the slides in advance so they can follow along during the session.
That would be an Adrian question as far as posting the slides on the platform there.
But the slides are available when the session room opens under the content. Is that correct?
That is correct.
Okay. So Vic, Adrienne, I'm sorry, are they able to access those ahead of time, or would those just be when the session opens?
Yes, they could access them ahead of time. Under contents, there should be handouts pre-posted.
So if they just go to agenda and the session that they're going to attend, and then content, then the slides should be available there. Is that correct?
That is correct.
Okay, great. Okay, we've got about 3 more minutes here. I'm not seeing any other new questions. If anybody, any of the panelists had any final thoughts or comments that they wanted to make, I'll just go ahead and turn it over to anybody else who wants to jump in for the last minute or two.
I'd like to ask Pamela and Adrian, because you mentioned using a Promotora or model or studying that for resiliency, and they have a wonderful also saying of nothing about us without us, and which I think is reflective of all you've been saying, Vicki. So I was just curious if Adrian and Pamela, if you have any findings yet to briefly share about resiliency and Promotora models.
I think who you meant was Robin and I.
Oh,
So I'm going to talk a little bit first that, so we have not had any results yet on this grant that Robin spoke of, because it hasn't technically, I think it just starts next month or this month. But I mean, I think all of us are aware of the gazillions amounts of research in the health world about the use of Promotoras. And so it's out there, folks. And I have absolute confidence that this grant that Robin spoke of will be successful. So Robin, do you have anything to add?
I really don't. You know, there a huge number of the community engaged research faculty that we have at UC Irvine do different projects with Promotoras, and so it's a very widespread thing that's used in our area. And but as far as, you know, like Pam said, research regarding this particular thing and resilience, we don't have specific results yet. No.
Okay, I'm gonna just jump in here. There were a couple of additional questions here. Adrian, actually one of our strategic partners, or one of our close friends, Julie McKinney, who runs the discussion list, said, it seems that the accordion that you click on only works in the link you get from your registration, not from the Solution Center's website. So Adrienne, any comment on that, or if people are having issues with that?
Yeah, I'm not sure about the Solution Center website, but I definitely know from the agenda accordion, that's how you get access to all of it.
So now that so once this session ends, they should be able just to go back to the conference homepage, click on agenda, and then they should be able to get in, or they will not need an additional Zoom link to get in, as we sent with some people as a stopgap.
Correct. Yeah. So
okay.
when they go into the accordion, it's going to say agenda. They're going to hover over the next session. That will be at 1 p.m. They'll click on view session. And when they click on view session, it will give the contents of the event, and it will tell you what time it should start. And then it will open up as soon as we hit broadcast.
Okay, so just a couple of quick things. Adrienne, if we go a minute or so over, are we okay, or do we get cut off?
A minute or so over is more than fine. It'll get cut off if I hit end.
Okay, so first off, somebody was asking again about continuing education. We have CHES credit, nurse credit, I believe MLA credit. Rachel, do you know, do we have CME credit? I believe we have CME credit as well. Any ones that I'm missing? You're muted. You're muted.
Also for librarian and also for social workers.
Okay, thank you. And again, as long as you indicated that you wanted that credit, if you didn't indicate it, just go back and modify your registration, get your initial registration confirmation and do that. And there was one question that somebody said, could you, does anybody have any advice for somebody during this time? I'm sorry, oh, here we go. What advice do you have for individuals that have lost their jobs during this time? This is from Deanna. First of all, Deanna, I'm so sorry to hear that. And I wish you the best of luck on that. Does anybody have any last minute advice for Deanna in terms of anybody who has lost their job during this time? What would be your words of advice? Or this is a tough one. This is a tough one.
Yeah.
I'll go ahead and jump in. I think the first thing that this person needs to do is reach out into the community. Hopefully there's like a 211 number or someplace they can call to get general referrals. But I think this is the time when our nonprofit community really shines, because we're there to fulfill services and needs that aren't being met in traditional manners. So the help is out there, I'm sure. It's just finding it.
And also, Deanna, on the conference website, there is a tab called Engagement Center. If you click on that, there's one called Message Board. That's a place where we're encouraging people to network. So you might post a note there saying your name, your email address, and what you're looking for, what your competencies are, and hopefully somebody in the community will see that, and either if they have something or that they might be able to connect you up with something. I think that's all the time that we have for now. Again, my apologies for the technical difficulties. Again, all these sessions will be recorded and available about a week or two after the conference finishes, hopefully sometime, actually just in the beginning of August. We will send you out notices when those when the videos are available. So whatever you missed today, you will be able to go back and see. Once again, I'd like to say thank you to Vicki and to all of our panelists. Thank you so much for being here. Thank you to everybody for your patience while we had some technical difficulties with the site. And I hope you have a really good experience for the rest of today and for the rest of the week in the conference. We'll see you soon. Thanks very much, everybody. Take care. Bye-bye.